Hello, my name is Denise Wilson and I'm currently working as a senior community matron. Part of my role has been to lead on improving the knowledge and understanding of the NHS continuing healthcare framework. In an attempt to unravel some of the issues surrounding the fast track process, I have developed this short audio presentation which shouldn't last any longer than about 15 minutes. This slide just shows an overview of the areas I plan to cover. So if we move on to some important facts about the fast track. The eligibility. The only requirement for the fast track funding is that the patient has a rapidly deteriorating condition and may be entering a terminal phase. There are some common misconceptions about this. There's no particular time frame of days, weeks or months of remaining life, and entering a terminal phase is not intended to be restricted to those where death is imminent. So it is important to complete the fast track in plenty of time so that the patient can obtain a package of care in a timely manner. So when would we complete it? The purpose is to obtain care quickly, without delay, whether this is in the patient's own home or 24-hour nursing care. It should also be completed if the patient is receiving a package of care, as they may be funding their own care, or this may be funded by social care. Who can complete the fast track? The fast track can be completed by any appropriate clinician, whether this is a registered nurse or a doctor. It doesn't have to be a nurse, but it usually is a nurse. The clinician must be someone who has an understanding of the patient's diagnosis, treatment and care, and be able to provide an assessment of why the individual meets the fast track criteria. So on to the documentation. I am going to show you a couple of completed fast tracks, but first I just want to show you where to find the documentation on System 1. So I have just opened a test patient. If we scroll down the clinical tree, we'll find the CHC fast track link. We right click on it, applications and forms, and this takes us to the forms to be completed. So the forms we are looking at for the purpose of the fast track would be the consent. That is quite a new thing. We didn't used to obtain consent for fast track. Well, we did, but not a written consent. We do now need to obtain a written consent. The fast track care plan, the fast track pathway tool, and also the fast track review form. Okay, so if we go back to the presentation for now. So consent. It is important that we obtain consent before the process can begin. It is important that the patient understands the purpose of the assessment and that they are happy for information about them to be shared with other health professionals or social care colleagues. If, however, following assessment of mental capacity, the patient is unable to consent to the CHC process, consent can be given by you as a health professional in the patient's best interest, or alternatively, consent can be obtained from the patient's representative if they hold evidence of legal authorisation, such as LPA, which is lasting power of attorney for health and welfare. I'll just bring up an example of the consent form. Okay, it does at first glance look quite a long form. The first couple of pages are just around the consent and what the patient is consenting to. The first part of the form is the part to complete when the patient has capacity. And the second part is when they don't have capacity. Part 2 does include a mental capacity assessment and a best interest decision, which is to be completed by either the professional, or part 3, the person who has LPA can actually sign on the patient's behalf in best interest. Okay, we'll just close that down. What I would say is, even if the patient can give consent, it is good practice to invite the family to the assessment, or close friend or representative. So the fast track pathway tool, this is the main body of the assessment. I'll open up one that I've completed. This is a real case, anonymised obviously. The areas in red are the areas that I've completed. So in the main body, it's asking you to evidence why you feel the patient meets the fast track criteria. Okay, so this is a man who has adenocarcinoma of sigmoid colon. He's got widespread Mets. He's been in the hospice for a couple of weeks, and at that time they didn't feel he needed a package of care. Since his discharge, he had deteriorated quite significantly, and like I say, you can see from the assessment he's become quite confused, sleeping more, reduced mobility, and he now requires a package of care. I hadn't actually met this patient. He was and he wasn't known to the community nurses, so I did actually have to obtain some more information from the hospice, really just to judge where the patient was in terms of the deterioration, and gauge if he had over the last few weeks deteriorated, and they confirmed that yes, he had. They were also happy to put something in writing, which often you can ask the GP to do so. Other evidence you might include that the patient's at that stage is whether they've had a DNAR completed, whether anticipatory medications have been prescribed, and any letters that you have. I forwarded a copy of the discharge letter from the hospice with this application. It's just more supporting evidence for your application. This bit is just to confirm what you've completed in the fast track. Then you just sign and date it. There's an equality monitoring form to complete. You do need to make sure that you complete every single box, otherwise the application would be returned. Okay, so that's the fast track pathway tool. So if we go on to the actual care and support plan, again, this is one I've completed. This is the same gentleman, and again, the areas in red are the areas that I've completed. And in this, it is a representation of the patient's care needs. So it covers all the domains. And really you need to give, a good description of the patient's needs, because this care plan is then forwarded to either the care agency, or if it's a care home, just forwarded to the care home, and this informs them of what care the patient requires. So it is important that you are thorough. It also supports the level of needs that you're saying they need in the first document. You might also include who is actually going to complete some of the tasks. So in this case, Andrew was going to obtain some assistance from family in terms of medication, so we've included that. And if obviously the community nurses are visiting for symptom management, we would include that here, just to try and give as much information as possible. There is a copy, I know I'm flicking through this, but there is a copy of this, the pathway tool and the care plan on System 1 under Test Patient. And if you search under Test, and you'll see Fast Track, go into comms and letters, and you'll see these 2 completed documents there. So in this section you are just stating whether the patient needs care at home, which is what this gentleman wanted, or if they needed 24-hour care, this is where you'd tick. We'll go through the different types of budgets in the next couple of slides, and then in this section we'll put in how many agency visits are needed per day and how many carers at each visit, and what district nursing interventions are required. And then you need to include the length of the home care visits. What I've found is you do need to be specific, and I know that's difficult sometimes, but if you put 30 to 45, it will be returned because the CCG needs you to be specific. So I normally make the morning call longer, because obviously that's when the bulk of the care would be carried out, and then I usually make it sort of shorter calls if it's depending on what the level of need is, but throughout the day it's usually repositioning, medication prompts, assistance with meals, that sort of thing. This section of the form is new, and this is where you can include any expectations from the patient and the family, and how you might achieve that. And again, any informal support you'd include here, any risks, environmental issues, key safe, include here, and then you'd sign and date it. Save it on System 1, and then email it via System 1 to the CCG, along with the fast track pathway tool and the consent form. Just a little tip, often the forms get returned because there's an area perhaps hasn't got enough information, or maybe the patient's needs have changed slightly since you've completed the form. To avoid having to redo the whole of the care plan or the tool, what you can do is, and what I tend to do is, you can copy and paste the whole of the document, open up a new Word document, and then paste the original document into the new Word document. You can then edit it and save it and email it via NHSnet to the CHC team. You would then need to just get that form scanned on because it's a new care plan, but it does save a lot of time. Okay, so the types of funding. So obviously when someone meets a fast track criteria, their total package of care or 24-hour care is funded by the continuing healthcare team, but they do have some options now in terms of the type of budget they can expect to receive, and this is based on patient choice. So there's 3 types of budget: notional, a managed account, and direct payments. So this may be that the notional budget, for example, this is your usual form of package of care. So the CHC would be responsible for arranging the care and the support, obviously based on the patient's needs and wishes and in agreement with the support care plan that you've written, and this generally is the most commonly chosen option. The managed account is whereby it's managed by a third-party organisation such as the care provider, who will make arrangements for the services the patient is receiving, and the third party may well charge for this service. And the third type of budget is direct payments. So patients may want to receive the cash themselves. It is paid into a separate bank account specifically set up to receive a personal budget, but they would need to buy in and manage the services themselves according to what's been set out in the care plan that you've written. Direct payments is probably unusual for a patient who's at a fast track stage though. Obviously it is quite a complex area around the budgets, and what I would say is if you're unsure, then speak to the continuing healthcare team and they'll be able to give you some more guidance. The fast track review form is the form that we use to review any patient changes. There is an obligation to complete the form every 2 weeks. It's only a 1-page form. It's pretty self-explanatory, but the main time we'd probably use it is if there is a change in the patient's needs. Usually the patient's deteriorated and requires a bigger package of care, or on occasion the patient's improved and the care needs to be reduced, or sometimes they may no longer be in the fast track stage. So that again, that's on System 1 and can be completed on System 1 and emailed via System 1. And just finally, just a few other issues, areas to consider with our end-of-life patients. Have they got a DNAR in situ? Have they been coded on the GP Gold Standards framework? Have anticipatory medications been prescribed along with PMAC? Have they had or do they need an emergency healthcare plan, which is a document to put in place by the GP or the community geriatrician to avoid unnecessary and unwanted hospital admissions? The palliative care handover, obviously this is very important to share with the end-of-life facilitators and GP out of hours, and then just whether any additional support is required, such as Marie Curie, hospice at home, and finally the DS 1500. If they're already on a high rate attendance allowance, this would be the same amount anyway. Okay, so that's the end of the presentation. I hope it was helpful. This is the contact detail for the continuing healthcare team, their phone number and their email address. If there's any concerns, any questions, I'm sure they'll be happy to help. Thank you.